But today we do something very important. 2 days from now, we actually mark World Diabetes Day. And today being a Healthy Thursday, we're kickstarting rather early, ending diabetes. But how exactly do we go about it? Some 700 million adults aged between 20 and 79 years will live with the disease by 2045. That is a morbid projection there. Currently, as of 2019, we're told some 463 million people were living with diabetes. Now, this morning to delve into the matter, we are joined by Dr. Charlotte Ampong, who is an endocrinologist. That's quite a mouthful of a word, endocrinologist. And she's going to be sharing with us some very important details when it comes to diabetes, its prevention, the statistics or the rate in Ghana, and what can be done to mitigate the situation. I'm sure, as you can see on your screens now, 79% of adults with diabetes were living in low and middle income countries. And guess what? That includes us right here in Ghana. On that note, let me say a very good morning to Dr. Charlotte Ampong. Thank you for coming.
Good morning, and thank you for having me on your show.
It's a pleasure. It's a Healthy Thursday, and we're hoping that a lot of those watching us will pick the tips needed for all of us to stay healthy. But this phenomenon, medical phenomenon called diabetes, what exactly is it? I pose that very simple question because a lot of the time people ask you, oh, is it too much consumption of sugar that leads to diabetes? Is it when your pancreas malfunctions and isn't producing enough insulin? What exactly is diabetes?
So diabetes is a condition in which your body finds it very difficult to manage appropriately the blood sugar. And usually when we eat any form of carbohydrates after digestion, this would eventually become glucose. Now, glucose is extremely important for the body cells because they use it as energy. And in order for the cells to be able to use this glucose, they need a hormone called insulin. Now, this insulin is produced from a very important organ that lies behind the stomach called the pancreas. Now, within this pancreas, we have certain very important cells that produces the hormone insulin. Now, in people who have diabetes, for one reason or the other, their bodies do not produce enough insulin, or they may be producing enough of it, but their bodies are not recognizing or making very good use of it. And so as a consequence of that, their cells are unable to pick up the glucose. So because of that, when you check their blood sugars, you find that it's really high, simply because their bodies are unable to utilize the glucose from the digestion. Many a times people feel that it's because of the name, and especially when you come into our local parlance, people feel that it's because people eat too much sugar.
That's why area, like we call it in Tree.
That's why they end up with diabetes. But that inherently is inaccurate. Generally, there are risk factors that will predispose a person to developing diabetes. And one of the major risk factors for developing diabetes is obesity. And I can understand why people link sugar with diabetes, because if you take in too much refined carbohydrates, it's likely that you may end up putting on a lot of weight. And so that may predispose you to diabetes, but not necessarily because the person is eating too much sugar. So with diabetes, any form of carbohydrates, excessive use of carbohydrates may predispose you to developing diabetes later on, especially if you were to put on a lot of weight.
Right.
Okay.
Doc, I would just have you, elaborate further on that point, because when you look at our staple diets here in Ghana, we consume a lot of carbohydrates. Now, you're talking of refined carbohydrates and all of that. Can you break it down? I'm sure that those watching us, listening to us this morning would want to find out, what are refined carbohydrates? Okay,
so when it comes to carbohydrates, we have the natural and the whole grains, and then we have those that have been processed. Right. Okay, so for instance, if I were to give you examples of our natural carbohydrates, maybe our plantain, our yam, our cocoa yams and even rice. But when it comes to the refined foods, you may be thinking about some form of flour, processed, let's say pastries, all the sweetened things you can think of, whether it's ice creams and meat pies and any sort of.
So all the croissants,
yes,
the cakes and all of those, they fall into those categories?
Those kind of refined carbohydrates. When it comes to making choices, we want people to choose more of whole grains, okay? So indeed, our plantain is still healthy, our yam is still healthy, but we just want you to minimize how much of it you are eating, okay? So for instance, if a person is going to take a meal, the amount of carbohydrate should be minimal compared to the, let's say, the stew or soup portion. You can introduce a lot of vegetables as well within your meal to help make you fuller without having to eat too much of the carbohydrates as well. Yes. But when it comes to the other risk factors, it's not just obesity that's a risk factor for diabetes. By living a sedentary lifestyle, not having enough exercise, it's a reason why a person may develop diabetes. Again, people who come from families with a history of diabetes. So for instance, if your mother or your father has diabetes, then you have a higher risk of developing diabetes.
Right.
And so such an individual would really have to be careful about what they are eating so that they don't put on weight, make sure they are engaging in enough exercises so that they don't develop this type 2 diabetes.
So it's hereditary. If you find out it runs in your family, it
yes,
means you stand the risk of getting the disease, and so you should start watching out.
Yes, it's extremely important. So if you have a relative who has diabetes, you have to understand that you are at risk, and so you must engage in all the lifestyle changes that would minimize your risk of developing diabetes.
Does this apply for young people as well, very young children and all of that? At what point do you think, or do you say, well, it runs in my family, I ought to start watching what I consume? At what point do you look at that?
So indeed, diabetes can affect both children and adults, okay? But generally, the type that tends to affect adults is the type 2.
Right.
Both type 1 and type 2 do have a hereditary component. So even if you are a child, you still have to watch your diet, because these days we are having a lot of children coming in with, because of obesity, also having diabetes. Although we do know that more often than not, when the younger people do have diabetes, it may be the type 1. That may not necessarily have to do with their weight gain as well.
Now, let's look a bit at the statistics. Let's focus the camera on Ghana. Now, we've seen how globally almost 470 million people in 2019, suffering diabetes in different forms, type 1, type 2, and all of that. But when you come to Ghana, what do the statistics reveal? I'm talking about age, I'm talking about gender. What are the dynamics when it comes to Ghana?
Okay, so unfortunately in Ghana, we do not have so much data, but a recent meta-analysis that was done put our prevalence at around 6.4% of the population, which is quite a significant number. There's still the need to break down the data to be able to give details on various ages, but currently our prevalence stands at 6.47 of our general population.
Now that, off the top of my head, 10% of a population that is about 30 million would be 3 million. And so if we're looking at 6%, that would be maybe anything between 1.8 and 2 point something million. That's quite a number.
Yes, that's really staggering. And indeed, that is for people that we think we have diagnosed. And globally, we understand that 1 in 2 people who have diabetes have not been diagnosed. So if you extrapolate this number, then it may be way higher than we are even thinking. So indeed, diabetes is a global problem, and it's a big problem in Ghana as well.
So very topical issue, but I also know that, for example, it leads to many other things. Diabetes can lead to blindness. It can lead to the amputation of limbs because sometimes you get sores that don't heal and amputation has to happen, kidney failure, even cardiac arrests and all of that. How do we nip it in the bud? I know you can't, maybe you can, but creating a society where no one has diabetes might be tricky, it might be difficult, but what more do we do to ensure that people know, what are the causes of diabetes and how to cater for themselves, even if they have it?
So we need to tackle the risk factors, and we also need to do more education. So in terms of tackling the risk factors, like I mentioned, especially for type 2, it's the weight gain that's the problem. So we need to make sure that our people have a healthy diet, more in whole grains, are avoiding the refined foods like the white breads, the ice creams, as much as possible. White rice is also a problem. So we can opt for something like brown rice, and then we eat a lot of vegetables as well, because that is filling and also doesn't contribute to the weight gain. But aside that, we need to have a culture of exercise, because generally in our society, exercise is not something that we are really used to. We need to incorporate that into our day-to-day activities to make sure that we stay fit and then we stay healthy. Apart from that, another risk factor that didn't come up again was one called gestational diabetes. And I want to use this platform to talk about it because oftentimes this gestational diabetes is diabetes that a woman gets while she's pregnant, right. Usually from the 24th to the 28th week. So many of these women originally, before they got to that level of pregnancy, do not have any sugar problems, but later on develop that. Now what happens is that usually at the end of pregnancy, many of them may revert to normal, okay? So we tend to forget about them, but it's a big risk for developing diabetes later on, and we shouldn't forget about these women. So we need to follow them up and make sure we take them through the lifestyle management and help them not develop diabetes.
That's a very interesting point you make, because I hear some of those women, hypertension, diabetes, it's a cocktail of many things that some of them get, which means that if the health system does not cater for those issues after they have delivered, it could degenerate into some other problems.
Yes, so the watchword here is to continue to follow them up.
Right.
Because like I mentioned, many of them may revert to normal, but it doesn't mean that their risk is gone.
Are we doing that though? There is the postnatal care and all of that. Our health system, do we focus on that?
So for the initial 6 weeks, it's not a problem because the women are in clinic. Right. But subsequently, the follow-up becomes a problem. And we need women to understand that if they ever had a problem like that, they need to come regularly to have their blood sugars checked. Right. Again, for people with hypertension, the risk factors for both diabetes and hypertension are virtually the same. So having hypertension is also a risk factor for having diabetes, and such people need to regularly check their blood sugars to make sure that if it's developing, we work on it as quickly as possible.
So our guest this morning, Dr. Charlotte Ampong, she's an endocrinologist, and our focus this morning is on diabetes, as 2 days from now we're going to mark World Diabetes Day. The theme for this year's celebration, if you can call it that, is the nurse in diabetes. How important are nurses in dealing with this scourge called diabetes?
So nurses are really crucial in the development, in the management of diabetes. All over the world, we have the nursing fraternity forms about 50% of the health workforce. So you can just imagine how important they are. Now, when it comes to the management of the patients in the clinic, the nurses are extremely important, as well as the education. The nurses help educate our patients on even how to take their medications, how to use their insulin. They talk about the lifestyle management with the patients. They talk about the diet. And then when patients are on admission as well, these nurses are also very important in helping us manage the patients. So right from diagnosis, the nurses play a very crucial role.
And talking about crucial roles. A lot of people who have diabetes also end up with some kidney situations of a sort, and then dialysis comes in and all of that. But we also know that in many countries, even in more advanced countries, the machines involved are not always so accessible. Here in Ghana, what is the situation? There are times when you encounter people, I mean, some of them are on social media trying to solicit funds and all of that because it's so expensive to be put on a dialysis machine. What are the dynamics with regard to that? And are there any moves in the health system, in the health sector, to ensure that people living with diabetes, the over 1 million or so people living with diabetes in Ghana, can have access to quality healthcare? So
indeed, having to go on to dialysis is extremely expensive, and it is a heartbreaking diagnosis to have.
Just how expensive is it?
At least, before you even start your dialysis, just for the procedure, you may end up spending close to about $1,500, and then subsequently $100 just to get in your tubes and to prepare you for the dialysis. However, since a person on dialysis may need ideally 3 sessions a week, you wouldn't spend less than about 800 to 1,000 cedis every week. Wow. To be able to do, and that is aside your medications, and if you get any infections, any labs you have to do. So you can just see how expensive it is. Now, what I want to say is that largely it is preventable. Type 2 diabetes leading to kidney failure is preventable. So we do not want a situation where most of our patients are ending up on dialysis, because indeed out-of-pocket payments is not feasible unless maybe an insurance scheme comes in or a company comes in to help the person tide through.
So what usually happens with people who are unable to pay, whose kidneys are basically on the verge of collapse? What happens to such people if, like you're saying, some insurance company or some entity doesn't step in on charitable grounds? What happens to them? Do they die? Is that it?
So for most of these people, what happens is that because they cannot afford the dialysis, some people may even opt not to do the dialysis at all. And those who can manage to get a bit of money may do fewer sessions, and all these ends up in early mortality, early death for these patients.
Wow. So the earlier you get to know, I mean, then like in the case of breast cancer in the West, it begs the question, how do we check ourselves to ensure that, is it the simple blood sugar test? What do we do to, find out early whether we have the signs of diabetes and to do the right things to avert getting on, dialysis?
So I'd like to talk about the symptoms, so that if there are any people currently going through that, they'll see the need to hurry to the hospitals to get their blood sugars checked. So typically with diabetes, you may have excessive urination, and then you may feel thirsty all the time. For some people, I must add that for some people in the early stages, they may not have any symptoms. But if you are currently urinating a lot, you go to bed and get up about 3 or more times to urinate, and then you're always thirsty, you need to report to the hospital. Apart from that, people may have blurred vision. They feel like they're not seeing very well, although they do not have a refractive problem. And that is an indication for you to seek help from the hospital. Some people end up with frequent infections, maybe frequent boils. Like I said, frequent infections, maybe frequent urinary tract infections as well. And that is a sign that you should hurry to the hospital to make sure you do not have diabetes. And many people complain of numbness in their hands and in their feet. It may be a sign of diabetes. So if you're having those symptoms as well, it's important to report to the hospital. A few unfortunate people may come in when the disease is really advanced, so they may be coming in with the complications. And that's where we find them maybe even coming in a coma. And that's what we don't want to see, because when it happens like that, your risk of death is also higher. Again, another presentation we are currently seeing is some people for the first time will be coming in with a stroke or a heart attack. So that's how dangerous diabetes can be. So to make a diagnosis, usually what we do is a very simple test. Either we do your fasting blood sugar when you haven't eaten for a period of about 8 to 12 hours. So let's say it's an overnight fast. There's a simple test where your blood is taken, and then we check out for how much sugar you have in there. So a value of about 7 and above would place you in the diabetic range.
Right.
Yes. And then there are other tests like the A1C. This A1C tells us what your blood sugar control has been over the past 3 months. So it's like an average sugar. Okay. It's also a way of diagnosing people of diabetes as well.
Wow.
So if you have a range of about 6.5 or higher, that puts you in the diabetes range.
Now, we have to wrap up shortly, but I want us to address 2 critical issues. One of them has to do with training and support. People living with diabetes or other endocrine illnesses. What sort of training and support exists for them?
So that is why we have a society like DEMSOG. So DEMSOG, what we aim to do is to lead care in endocrinology, diabetes, and metabolism. And generally, we provide advocacy for patients and we support them. We also do some research as well. But in most clinics in Ghana, what we have tried to do is to establish diabetes clinic. And this is important because when we are able to take patients living with diabetes away from the general population, we have more time for them. We're able to offer education. We're able to take them through what they need to learn, such that it's not just a normal clinic you walk in to see your doctor, but in that particular clinic, you have access to a diabetes nurse, you have access to a dietitian, you have access to doctors, have access to pharmacists as well. And all these people come together. They are specifically trained in the management of diabetes. And so it's easier to impact the knowledge to our patients.
This is a difficult question for you to give a yes or no answer to, but I would appreciate it if you could. Diabetes, the dialysis and the treatment, it's not captured when it comes to our national health insurance scheme. Do you think it's something that ought to be considered?
Definitely. It's one of the things I personally would advocate for. Currently, diabetes outpatient care and even inpatient care, parts of it is covered by the health insurance, but not everything. But something like...
Obviously not dialysis.
Obviously not dialysis. But I feel that going forward, it's important that the health insurance comes in to take care of the dialysis. Not just that, there's a concept called self-monitoring of blood glucose, which involves the patient checking their blood sugar to make sure they are well controlled. Because oftentimes what we are finding is that until patients come to the clinic, they never monitor their blood sugars. And so anytime they come into the clinic, the sugars are so high. It's this high sugar that's causing the damage to the kidneys and the other organs. Now, if we are able to help them by providing them with the glucose meters and providing them also with the strips, then they'll be encouraged to check these things and also to stay within range. And inherent and in the long term, we can even reduce the numbers getting to dialysis. So I strongly advocate that dialysis should be one of the things that we do for people living with diabetes.
Dr. Charlotte Ampong, it's been refreshing discoursing with you on diabetes, and hopefully we've given a lot of education to those out there who actually may have concerns, may be living with diabetes, and whose answers or whose questions you've given some answers to. Thank you so much for coming. That is Dr. Charlotte Ampong, an endocrinologist. Now, time to tell you a bit more about CORE. On a Healthy Thursday, we proceed with COVID-19, the Recovery and Resilience Program, also known as the CORE Program, which is an initiative of the Springboard Roadshow Foundation in partnership with Solidaridad and MasterCard Foundation. Now, CORE, that program was designed to provide support for young people in Ghana by mentoring and equipping them with relevant skills to enable them survive and thrive during and after the disruptions of the COVID-19 pandemic. Daniel Dazi has been engaging Comfort Okran, who is team lead for the CORE project. Here's that interaction.